Hello there, and welcome to today's episode of the Only Endometriosis podcast you need. Today I'm going to be talking about cysts. This is something that used to come up all the time. It used to be probably the most common question that I used to get asked in health clinics, just in general conversation. And actually I hadn't been asked about cysts for quite a while until it popped up in a workshop that I was running last week. So I thought it's probably quite a good time just to reintroduce it gently into the podcast. So today we are going to be talking about the different types of cysts that can occur in your menstrual cycle. We're going to have a little talk about fibroids, and I'm going to run you through some natural techniques you can use either to reduce the chance of cysts forming or to reduce their impact, reduce their size potentially if you do have them. So the first thing to say here is that cysts actually form a natural part of your menstrual cycle, and most, if not all, women will experience cysts at least one time during their natural cycles. Most often they go completely unnoticed, so they don't cause any symptoms, they last 1 or 2 cycles and they disappear naturally by themselves without causing any issues at all. The issues do happen when the cysts either don't clear, when they get bigger, when they grow, or when you get different types of cysts that are outside of the natural menstrual process. So today we're going to be talking through some of those cysts, the most common cysts that you can get, and what exactly they are. So if you've ever left a clinic, if you've ever left your doctor's surgery having been told that you either have a cyst, or chances are you have cysts or fibroids, but you're not entirely certain what that means, then this episode is for you. Quite often I talk to people who've been told they've had a cyst and they've go away and Google it, and the same with endometriosis, adenomyosis. Dr. Google can frighten the life out of you. So today we're going to demystify the world of ovarian cysts and just help you gently understand what's going on in your body, and most importantly, what you can do about it if you are worried. So again, with all of my podcasts, this podcast is not designed to replace any information or advice guidance you've been given by your specialist or by your GP. It's just designed to give you either a different viewpoint, a little bit of reassuring guidelines, or just a little bit more information if you're looking for it. So, like I say, cysts and fibroids are incredibly common. Fibroids are the most common diagnosis of all the menstrual health gynecological conditions. So the first thing to say is that you are not alone. If you're struggling with your symptoms, if you're struggling to understand exactly what's happening in your body, then you are not alone. Quite often they are completely misunderstood, and like I say, Dr. Google can frighten the life out of a lot of women who just want a little bit more information. So most cysts that you will come across are completely benign, and the opportunity for you to manage them naturally is very real. So the first thing to say is, or maybe the second thing, I've lost count already, is try not to worry. I know it's very, very easy to say, but try not to worry. It's not a scary diagnosis necessarily, and like I say, most of them are benign, so most of them give you absolutely no reason to be worried at all. So we're going to be running through all the different types of cysts, and then we're going to be looking a little bit at polycystic ovaries and fibroids as well. So if you're struggling with period symptoms like pain, bloating, irregular bleeding, but you don't have a diagnosis, then this episode is also worth a listen as well. I just want to say very quickly, just a bit of it's not a sales plug, but just in case I forget at the end, I'm just implementing a new thank you to all my podcast listeners. So if you listen to these podcasts, then you are eligible, entitled, whatever word you want to use, for a free endometriosis empowerment workbook. So in the show notes, there will be a link to let you claim your free workbook. It will give you a discount code which enables you to get it for free. And even if you don't have a diagnosis of endo, some of the tools, some of the tasks in there will be really, really useful if you are struggling with your diagnosis of cysts or polycystic ovaries. So I do invite you just to take advantage of that freebie as a thank you for listening to my podcast. So on with the cysts. So like I say, in this podcast, we're going to be talking through pretty much all of the possible diagnoses of cysts that you're going to see. The first type of cysts that we're going to be looking at are the functional cysts. So these are the cysts that, like I say, most women at some point will have in their cycles. They normally go completely undetected, and you would only really know if you had them if you happen to have some sort of scan, an ultrasound, whatever, at the time that they are there. Otherwise, they will just pass through without incident. So basically what happens normally during ovulation The egg grows within the follicle releases the egg trundles on its merry way, and the follicle sort of dissolves. It just shrinks and dissolves naturally. So the first type of functional cyst we're going to look at is the follicular cyst, which is exactly what the name suggests. It's the follicle, and the follicle doesn't release the egg. So essentially what happens is at ovulation, the hormonal imbalance or whatever happens isn't sufficient enough to release the egg. So the egg stays within the follicle starts growing, and it keeps growing until it either bursts naturally or it just stops and shrinks. So again, most times this will occur naturally as part of a menstrual cycle, and you would never know. Sometimes it can have a little bit of pain. It can cause a little bit of pain. That tends to be, I think, when it bursts. But ordinarily there won't be any pain at all. And like I say, it's incredibly common. Nothing to worry about at all. Most women don't even realise that it's happening. It can be, so I suppose it can be signalled by a delayed period, sometimes a missed period, but again, completely, I was going to say normal, I don't like that word, as you know, but completely natural, passing without incidents. This second functional cyst is a corpus luteum cyst, which to me sounds really romantic, but essentially the follicle releases the egg, but then the follicle itself doesn't shrink and dissolve like it should do. So it either keeps growing a little bit or it just hangs around for a bit, and then, like I say, after 1 or 2 cycles, it does just disappear. So both of those cysts are very, very common. Usually completely harmless. Obviously, if they keep growing, then they may need some sort of intervention, but ordinarily they just pass within 1 or 2 cycles, and most women don't even know they're there. So the second cyst I'm going to talk about, this proper freaked me out when I found out that these kind of cysts happened, which is why I'm going to get it out the way now, because if you listen to this podcast as you're falling asleep, I don't want you with this image in your head as you're falling asleep, because I know that I'm very sensitive to this kind of thing, but it proper freaked me out for quite a long time. So, dermoid cysts. So these cysts form from early embryonic cells, and it's nothing to do with fertilization. So it doesn't have to be a fertilized egg. It's just abnormal cell growth. And essentially what happens is that it's almost like your body fertilizing its own egg, which is not the scientific term. And please don't ask an obstetrician or a gynecologist to examine my explanation for that, because that's not scientifically the case. But in my head, that's what happens. And it's basically, I think it's a germ cell, so it's almost like an infection. Again, don't quote me on that. But essentially, these cysts form abnormally. So it's not linked to ovulation, it's not linked to fertilization, they just start growing. And they actually can contain elements exactly the same as an embryo. So they can have particles of hair, particles of skin and fat within the cyst. Ooh, just wait for that siren to go past. So again, these most times can be completely symptom-free. Most of them, again, are discovered accidentally. Now, when people say that, and when you kind of say, oh, they're discovered accidentally, whether they are actually discovered accidentally, obviously some of them will be. So if you're going for fertility tests, if you're just having a scan, then you come across these cysts. However, there will be a reason why you've had the scans normally. So it could be that your stomach's causing, that you're getting pain, that you're getting a little bit of pressure, sensations of pressure, or it could be for fertility reasons. So it could be it's cause and effect. They could be causing issues that need or that have warranted further investigation. But they tend to be discovered when people are looking for something else. Take that with a pinch of salt, as I say, because quite often pain and the symptoms that these do cause can actually be just normalised as part and parcel of a menstrual cycle. So I don't want to diminish the fact that actually these could be causing pain that does warrant further investigation, but they tend to be found when people are looking, when specialists are looking for something more sinister than cysts. But dermatoid cysts especially can twist the ovary, so you can get that sensation of twisting, that sensation of torsion around the ovary, and it can cause acute pain. More often than not, again, they disappear completely normally, completely naturally, and pass without instance. So you don't always have to have any sort of intervention to get rid of these. The same with the other cysts, the only problem arises when they continue to grow, but chances of them growing to a point where they cause real issues before they disappear naturally are quite slim. So endometriomas, this is part and parcel of some women's endometriosis. Not everybody with endometriosis gets endometriomas, but essentially they are cysts that are formed as part of an endometriosis diagnosis, or can be, and they are cysts that are full of the stagnant blood that we see with endo. So things like old blood, sort of that greyish, brownish, gunky blood, the endometrial type tissue that we get with endometriosis, they fill the cysts as well. They tend to be around the ovaries, and they're actually called chocolate cysts because of the colour that they form, obviously the colour of chocolate. So these cysts, when we talk about fertility issues, fertility concerns with endometriosis, endometriomas tend to be the main culprit of fertility concerns. So they either can block the ovary or cause some obstruction to the ovary, or in, I think, the majority of cases, the fact that they're there creates a slightly toxic environment, so it actually impacts the quality of the egg. So even if it's not in a position, so this is one of the things that I talk to my fertility clients about. If you've got cysts and you're being told that the position of the cysts won't impact the journey of the egg, chances are, if there is an issue, it's around the toxicity, the acidity levels that's being caused by the chocolate cysts being there. So again, whilst it might not be physically causing an obstruction, it might be causing an environment that just impacts the quality of the egg and the quality of sperm when the sperm's in that area. They can trigger chronic pelvic pain as well. So if you've ever had a cyst, one of these endometriomas cysts, you'll know that they can cause acute pain right at the point where they are. Again, quite often they can disappear by themselves, but more often than not, they will continue to grow. And if they are found on a scan, then they tend to monitor them and they will intervene when they get to a certain size. So the next type of cysts we're going to look at are cystodermas, which are very, very similar. They develop from the outer surface of the ovary, so they're actually kind of sitting on top of the ovary themselves. And again, they can fill with something similar to the endometriomas, but it's just a mucousy, watery fluid rather than the kind of the gunky, stagnant old blood of endometriomas. But it's very, very similar. Again, usually benign, normally not causing any issues themselves. But again, if they continue to grow and if they don't disappear naturally by themselves, then they will be monitored and they will be removed surgically if they get beyond a certain size. Polycystic ovaries. So as the name suggests, polycystic ovaries is where we have tons of cysts. So it can be cysts that are, all of the cysts that I've mentioned can be included in polycystic ovaries. It might just be some of the functional cysts, but a lot of them. Essentially, basically, what's happening is exactly the same. Follicles don't mature and release an egg, but the cysts don't disappear. You can get a mixture of endometriomas as well. So many women that I work with have a cross-diagnosis of endometriosis and polycystic ovaries. Now, we're never essentially sure which is which in terms of which cysts are which. So you can just see on the scan you've got lots and lots of cysts. But I've worked with some women who report that some of them are endometriomas, some of them are your functional cysts that have just not disappeared. The way that I work, and I suppose, I don't know, I can't speak for anybody else especially in terms of Western medicine, but it doesn't necessarily matter. The fact is that you have a lot of them. So there's very many of them. They're technically, again, by themselves as individual cysts, they're quite benign, they're quite harmless. The problem is that they're not shifting by themselves. So the hormonal process that normally sees, the hormonal process or the environment which is conducive to the cysts in inverted commas, so the follicles normally sort of dying away by themselves, isn't actually happening. So they're getting more in numbers, potentially getting bigger. So it's causing a whole multitude of issues because of that, rather than the actual cysts themselves, if that makes sense. So symptoms of polycystic ovaries, you can often get skin conditions, so acne, also really dry skin I've seen, irregular periods, weight gains, excess hair growth as well, and hormonal imbalance. So hormonal imbalance doesn't necessarily come with all of these other cysts, even endometriomas. You're not necessarily going to have a massive hormonal imbalance. It can cause shifts, and it can cause hormonal imbalances over time, but it's not necessarily caused by hormonal issues. So fibroids. So fibroids, again, like I say, are the most common diagnoses of all the gynecological conditions. I do think sometimes I have worked with not a massive amount of women, but certainly over the years I've had regular occurrences of women who've been diagnosed with fibroids. But actually it could be something else. It's just fibroids are relatively easy to diagnose when compared with endometriosis. So I do wonder if some women are misdiagnosed, but if you have been diagnosed with fibroids, take that diagnosis as face value, unless other things are going on as well, in which case please do go back and ask for second opinions or further investigations. So fibroids happen around the womb, not necessarily, although it can happen around the ovaries, but primarily they happen around the womb, and they are non-cancerous sort of fibrous tissue growth. There is a hormonal element to fibroids, so they are sensitive to estrogen, and chances are they're only going to grow during your reproductive year. So as long as you're having a menstrual cycle, you will continue to have if it goes unchallenged, untreated, you will continue to have your fibroid symptoms. This is one of the things I say around HRT as well. If you do have anything that's sensitive to estrogen, if you've had fibroids in the past, then if you have either a natural or an induced menopause, just be very, very wary if you're having GPs or other people telling you to go on HRT to reduce the impact of your menopause, because if you have estrogen sensitive condition like fibroids, if you start on the wrong HRT, that can often flare up your fibroids as well. So to say that it only happens during your reproductive years is technically true, but it can also be brought on by certain hormonal replacements or hormonal treatments for other things. So just be very, very wary, and it shouldn't be up to us to ask our doctors or our specialists to be mindful of this, but quite often it is just worth knowing, because if they haven't checked your notes, or if it's not in your notes when it comes to things like HRT, it is worth just pointing out and just asking whether the treatment that you put, and not just HRT but other hormonal treatments, whether the treatments that you're putting they're putting you on is compatible with fibroids. And other cysts as well, if you want to ask. There's nothing wrong with asking at all. So there's 3 different types of fibroids. So you have the most common one, which is sort of around the womb, the wall of the womb. The second one is actually in the womb lining. So again, it possibly could be misunderstood or misinterpreted, misdiagnosed as adenomyosis, or the opposite way around, although diagnoses of adenomyosis are still relatively uncommon compared to, I don't know if that's the right word actually, but it's certainly not the first diagnosis that comes up, adenomyosis. Fibroids is probably going to be the most common diagnosis, but it may be that you actually have adenomyosis, but that's been misdiagnosed as fibroids. So the question that, just about to get another siren going past, something's going on. So the question that came up in the workshop last week was around symptoms. So what are the symptoms of cysts? How can I tell whether I've got a cyst or whether I've got something else? And the honest answer to this, hang on, and carry on. The honest answer to this is that it's actually really difficult to answer that question. A lot of the symptoms that we get with problematic cysts, so cysts that go beyond the functional cysts, can be misunderstood for other symptoms. So I don't really want to dwell on the symptom aspect of it. So if you Google the symptoms of fibroids, for example, it will come back and tell you that the symptoms of fibroids are things like heavy bleeding, abdominal pain, frequent urination, sometimes fertility issues. If you Google the symptoms of endometriosis, of adenomyosis especially, then you will see that they are very, very similar. If you Google the symptoms of endometriomas, they can be very, very similar to other cysts. So it's really, really difficult to say that if you're experiencing A, B, C, that you're definitely going to have fibroids or polycystic ovaries. Having said that, I'm going to slightly contradict myself because polycystic ovaries is probably more diagnosable, in inverted commas, because of the symptoms than the others, because there are symptoms that are way more common with polycystic ovaries. So, for example, the hair growth doesn't necessarily follow, but polycystic ovaries does seem to have way more of a hormonal imbalance element than any of the other things that we've talked about today. But that aside, symptoms are symptomatic of so many other things as well. So just taking the frequent urination, if you Google symptoms of fibroids, then frequent urination comes up normally in the top 5 symptoms of most websites that are listing the symptoms. However, I have worked with plenty of women over the years for whom frequent urination is a very, very real symptom of adenomyosis, endometriosis, pelvic floor issues, and even a psychological element as well. General muscle tension, trauma, stress, anxiety. So even the frequent urination thing, if you're getting frequent urination, it doesn't necessarily mean that it's fibroids, but B, it doesn't necessarily mean that you can't do something about it. You can't tackle it naturally, that there aren't things you can do even without a diagnosis, even if it's just suspected, to reduce it. So that moves nicely on to the second session of this podcast, how to support, how to prevent, how to deal with cysts and fibroids naturally. So this is catch-all advice, and you know what I think about catch-all advice. I'm going to give you catch-all advice that I always say don't listen to catch-all advice, but it's kind of good catch-all advice. So in terms of diet, so the best things to do in terms of diet are the normal things that everybody always knows. So reducing processed sugar, things like reducing caffeine, reducing alcohol intake can help. I'm not going to say it does. Everybody is different. The important thing is to know what works for you. So track everything. If you see a link between eating dairy or eating meat or drinking caffeine or drinking alcohol, if you see a link between that and your symptoms flaring, then obviously reduce the things that are triggering your specific symptoms. But there is not a specific diet that is going to help everybody. You need to tailor your diet especially for you. One of the things that can help, like I say, reducing processed sugar and processed food is kind of a given. Eating more organic vegetables, again, is a given. I talk a lot about eating seasonally. So I talk about eating salads in the summer, root vegetables in the winter, eating the things that would be found around us naturally at that time of year. One of the things I don't talk about as much in this context, but actually when we're talking about cysts, problematic cysts, fibroids, polycystic ovaries and things, one of the things that is or can be really beneficial is to eat seasonally when it comes to our cycle. So you will have heard me talk, I hope you will have heard me talk at some points around how our cycles mimic the seasons of life, essentially. So, for example, ovulation is summer, so that's when we're at our most vibrant, at our most vivacious. Menstruation is our winter, that's when we kind of want to hibernate a little bit more. So if you eat your food tailored to the seasons of your cycle, so I suppose it's cycle syncing, but cycle syncing with food, then that can be really beneficial as well. Again, it doesn't help everybody. It depends to what extent the hormonal imbalance or the hormonal element is a symptom of your symptoms. Is a factor in your symptoms. But it is worth trying. Eat to support your liver, make sure you're detoxing, and by that I don't mean doing detoxes, I mean literally moving and hydrating. So the more you drink water, as I always say, I always stick just to water. So if you're looking to hydrate yourself, if you're looking to see how hydrated you are and looking to detox with water, it's literally water. Don't add anything to it. Don't include herbal teas. Literally just water. So if you're detoxing drinking water, that's going to really help as well. If you've got polycystic ovaries or suspected polycystic ovaries, or if you have an issue with recurring cysts, then looking at your blood sugar levels is really, really important. And again, that doesn't have to be massive amount of blood tests. It doesn't have to be massive amount of restrictive stuff. Just eating plenty of healthy protein and slow release carbohydrates can make a massive difference. Next, castor oil packs. You know I love a good castor oil pack. So if you haven't tried a castor oil pack before, definitely the key to this is good preparation, because it can get a little bit messy. So essentially what you need is some castor oil, some old rags, so something like old bandages, old t-shirts, old underwear even, ripped up. I always do it into relatively small sections. And what you do is soak your material in the castor oil. You pop it directly onto your tummy. Then a lot of people then put a layer of cling film over, just because it can get a little bit messy. The castor oil itself can be a little bit sticky and irky. So if you pop some cling film over, it reduces the risk of getting everywhere essentially, but you don't have to. Then I always put another layer of material. So I have maybe another tea towel, another small towel, then a hot water bottle, and then loads of blankets. And you literally lie there and enjoy the warmth. And essentially what it's doing is improving that improving that lymphatic flow. Not that easy to say. Improving lymphatic flow through your tummy, reducing inflammation, drawing out all the toxins. It's safe for most cysts. It's safe for most cycles and most people, but obviously don't do it if you're pregnant or you think you might be pregnant, and it's best to avoid it during menstruation as well. There are no major sound effects. There are no major side effects, but quite often some people have reported, if they do this castor oil packs very, very regularly, then they can see sort of IBS type symptoms, diarrhea and stomach cramps. So if that does happen, just reduce the amount of times you're using it. Stomach massage, pelvic realignment, that's really, really nice. So abdominal massage and pelvic realignment are really, really nice ways of just getting a little bit of movement through our tummies. So even if you're too tired, too achy, your fatigue's kicking in, so you don't have the energy to do any walking, any actual exercise, just getting some movement through our abdominal muscles, through our abdominal cavities, can be really, really beneficial. So doing an abdominal massage on yourself, always do it clockwise. We don't want anything going the wrong way. So beautiful, even very basic abdominal massage. Reiki, just pop your hands over your tummy, close your eyes and do some nice deep abdominal breath work. So even if your abdomen's just moving in time with your breath, again, that's a really gentle, really nice way of doing it, almost somatic release. Pelvic alignment when it comes to somatic release as well. So gentle rocking of your tummy. So if you can sit on your knees, so that your bum is resting on your heels, just gently rocking your pelvis backwards and forwards. You can do that in a standing motion as well, twisting your pelvis gently side to side. Anything that feels like it needs to be done. Listen to your body. So sometimes a movement can feel really, really natural and easy. I would say that's the movement that you don't need to be doing. The movement that you need to be doing is the movement that feels slightly jerky, slightly awkward. You really need to think about it. So my pelvis is tilted slightly. So I know that when it's starting to play up, the movement I need to do is the movement that doesn't feel natural. At the beginning of doing it, my body is almost like fighting against it. So the key thing to do is not to do it so that it hurts, but to listen to the body, take it to the point where it feels uncomfortable, and just gently breathe through it, gently, slowly move your body so you're getting full movement. So be that a full circle or a full pelvic rock. Just gently invite your body just to release all of that tension and really slowly and gently realign. It gets movement through. Again, it releases tension. It can release pent-up emotions that we've got hanging out down there, and it supports our ovaries, it supports our womb to function, because it's increasing blood flow, oxygen levels, water to that part of our body. Herbs and supplements, you know how I feel about herbs and supplements. there is a massive market for supplements, and people think that because things are badged as natural, that means that they're healthy and good for you. But actually, I would always urge you to go and see a registered, either a homeopath, although I know that that's not herbal necessarily, but either a registered homeopath or a registered herbal medicine practitioner, because they can tailor the medicine, because it is medicine. They are tailoring the medicine specifically to you, specifically to your symptoms and circumstances. So there is absolutely a place for supplements and herbs, but please do make sure that you're getting the ones that actually suit you rather than over the counter. I mean, things like magnesium, things like zinc, turmeric, they're kind of well known for the properties, the healing properties that they have. But that might not be what your body needs, and a practitioner will be able to tell you exactly which supplements, which herbs, which medicine is needed by you. And lastly, the thing that always sounds so easy to say and so simple to achieve, but really isn't if you are struggling, and that is to make sure that you are getting the best possible sleep you can and that your life is as stress-free as possible. As we know, anxiety, fear, stress, all of those hidden emotions that sit within us because of trauma, because of fear, can really disrupt our hormones over time. So protecting your nervous system, making sure that you feel safe, journaling, breath work, all of the kind of stuff that brings calm, no matter how you do it, bringing as much calm into your life is a really vital part of healing as well. So if you try all of those, you still need help, that's absolutely fine. I'm still running the health clinics on the first Tuesday of every month, so you're still more than welcome to come along to them, even though we haven't had a question about cysts in that clinic for a long time. More than welcome to bring your questions there. If you do have a diagnosis, or if you're worried that you need a diagnosis, please don't worry. There is so much you can do to support your body to heal naturally. So whether you are managing polycystic ovaries, if you're healing from endometriosis and you have endometriomas, cysts and fibroids are not the end of the story. They're not a massive hurdle to be overcome. They're just part and parcel of the signals, a part and parcel of the way that your body is communicating to you. And you are allowed to respond with care. So give yourself permission to gently approach these. So try and remove as much fear as you can. Give yourself permission just to relax, just to challenge it in a caring way, and take as much knowledge and support from all over the place for as many sources as you can. You don't have to wait and see. You don't have to wait until your cyst is at a certain point to have surgery. You can try all of these things to try and reduce the cyst naturally before you get to that point. So thank you very much for listening. As I say, you can download your free endometriosis empowerment toolkit from the link in the show notes. If you can't see the show notes, then if you go to my website, you can find the link for the endometriosis empowerment workbook. And the coupon code that you need is simply EndoPodcast. That will give you your £15 off, so you get that for free. If you do have any questions, like I say, you can either come to the health clinics or please do email me, because I always like to hear either feedback from the sessions or also ideas about what to talk about next week. So if you do want a specific topic chatted about, then please do let me know, and you may see it in a future episode. Wherever your endometriosis journey takes you, I wish you every health, every happiness, and if you need any more support, you know where I am. Until next time.